What if I told you that right now some of the most interesting conversations happening in the cancer world weren't about new pharmaceutical drugs or experimental treatments, but rather about medications that have probably been lurking in the back of your cabinets for decades? They're inexpensive, they're widely available, and chances are you or someone you know may have even taken them within the last few days without a second thought. They were never designed for cancer, they were never marketed for cancer, and yet they keep showing up in the literature. This is Stage 4 Thriver, and today we're talking about over-the-counter repurposed drugs. Let's dig in. Now, before we get into these over-the-counter drugs, I want to talk about why repurposed drugs matter in the first place, because I think this is where the paradigm shift really happens. Repurposed drugs, you may also hear them referred to as off-label drugs, or drug repurposing, or drug repositioning. They're existing medications that researchers study for uses that they were never originally designed for. So we're talking about drugs that have already been FDA approved, they already have known safety profiles, and we already understand pretty well what they do from a mechanisms standpoint. Now, the reason that they're so interesting in cancer care isn't just because they're accessible or affordable, although those things absolutely do matter, but really it's because of what they reveal about cancer biology itself. We've been taught to think about cancer as primarily a genetic disease. Mutations, runaway cells. And yes, that is part of the story, but cancer is also a disease of many systems. It thrives in specific conditions. It depends on inflammation, on immune signaling, on blood flow and nutrient delivery, basically the entire microenvironment around the tumor. And when drugs that were originally designed for totally different purposes, like allergies, pain relief, diabetes, etc., well, when they keep appearing in the cancer research, it really tells us some important information. It clues us into the complexity of cancer and all of the systems that it relies on. And some of this can go beyond what we expect. So with that frame in mind, let's talk about drug number one. Drug number one, Loratidine. You may already know this one. She also goes by the name Claritin. So what exactly is Loratidine? It's a second-generation antihistamine, the kind people take for seasonal allergies without even thinking twice about it. It's non-drowsy, it's over-the-counter, and totally unremarkable, right? Except it keeps showing up in oncology research. And when you dig into why, it gets really, really interesting. Here's the thing. Histamine is not just about sneezing and itchy eyes. Histamine is a signaling molecule that plays a role in inflammation, immune response, blood vessel formation, angiogenesis, and even the behavior of certain immune cells in the tumor microenvironment. I think it's okay to stop there for just a second and recognize some of these words that keep coming up over and over again, namely inflammation. Inflammation is the house that cancer lives in. I've said this before, and it's one of my go-to phrases, but it's true. If cancer had a house to live in and dwell in, that house would be inflammation. So the more that we bring inflammation down in the body, the more we kick that cancer to the curb, make it homeless. But also immune response. We want to bring down inflammation and increase immune response. Anytime you hear the word angiogenesis, that is referring to how the tumor creates new blood vessels. Tumors need a lot of blood supply. So when we can cut off its blood supply, it's basically making that entire tumor microenvironment weaker, which is a good thing. So anyway, there's another key player here, and that is mast cells. Mast cells are immune cells that release histamine when they're activated. In a healthy immune response, that is helpful. It's part of how your body fights off allergens or infections. But in the tumor microenvironment, mast cells can actually support cancer progression. They can promote inflammation, encourage blood vessel growth to feed the tumor, which is what I was just talking about, and create conditions that help cancer cells evade immune detection. So when you take an antihistamine, like Claritin or Loratidine, you're not just calming down an allergic reaction, you're potentially calming down some of that chronic low-level inflammation that cancer just loves to use strategically. Now, I want to be clear that Loratidine does not cure cancer, but it is part of an entire team. For me, when I think about truly curing cancer, I imagine an entire football team. You can't just win with a quarterback. I mean, yeah, that player is super important, but you need the whole team. And that's as far as that analogy goes, because I know absolutely nothing about football. But The sports team analogy does work, though, if you're thinking about offense and defense when it comes to an integrative protocol. In this case, I would think that loratadine is more on the defensive side of things. It's helping out the terrain of your body in a way that modulates the systems that cancer really depends on. These things all work together. We're looking for synergy. We're building a team in the integrative plan. Now, there's emerging research looking at antihistamines being used alongside conventional treatment as adjuncts. They're being looked at as tools that might just shift the terrain enough to matter. And here's what I find so powerful about this. A drug designed to calm allergic chaos may also calm biological chaos. We truly underestimate how much background inflammation shapes disease. We think of inflammation as this acute, obvious thing that's, swollen and red and painful. But what about the chronic systemic inflammation? That is a lot more insidious. It's quiet. It's going on in the background. Sometimes we don't even notice it. And that is exactly the kind of terrain that cancer loves. So that's loratadine. It's simple, accessible, and quietly fascinating. Check out the comments below or the description. I will put somewhere down there a link to a loratadine that you can get on Amazon for very, very cheap, very affordable. It doesn't have to be expensive. I know sometimes Claritin can be expensive in the store, so just check below. I got you. Now, drug number 2. So this one is so commonplace and average that you're going to have a hard time believing me, but I'm telling you, this is the truth. Are you ready for this? Low-dose aspirin. Yes, I am talking about that little medication that your grandparents used for their heart health. But did you know that it is one of the most studied drugs in all of human history? And the reason that it shows up in cancer research has very little to do with pain. It has to do with platelets. So we've been using aspirin for over 100 years. We know it inside and out, and yet there's still so much happening beneath the surface. Most people think of aspirin as a pain reliever, a fever reducer, or like I mentioned before, just something that lives in their grandparents' medicine cabinet. And at higher doses, that is exactly what it does. But at a low dose, we're talking about 81 milligrams, the baby aspirin dose. Aspirin does something totally different. It alters the behavior of your platelets. Now, if you're thinking, wait, platelets, aren't those just for clotting? I want you to hold that thought because this is where it gets good. Yes, platelets do help your blood clot. That is their day job, but they also do something else. They can shield circulating tumor cells. When cancer cells break away from a primary tumor and enter the bloodstream, which is one of the major steps of metastasis, they are incredibly vulnerable. The immune system is designed to recognize and destroy these foreign cells. But here's the problem. Platelets can coat those tumor cells, essentially hiding them from immune detection. And beyond that, platelets can help those tumor cells adhere to blood vessel walls and establish new sites of disease. I think it's really helpful to think of another analogy here of just a pipe getting clogged. And if you have a pipe that is clogged, imagine those tumor cells going through and getting stuck to the sides of the walls. They stick, they lodge in, and then they continue to grow. So the more that you can keep your blood flowing, and this should be beyond just low-dose aspirin, guys. This is why you want to be exercising, doing cardio, rebounding, moving your lymphatic system as well. All of this is scientifically proven to prevent metastasis and spread of cancer. So in this case, platelets aren't just passive bystanders, they are active participants in metastasis. And this is where low-dose aspirin becomes so interesting because aspirin at doses far below what you would take for a headache, they permanently disable the enzymes that allow the platelets to clump together. It doesn't kill the platelets. It doesn't thin the blood in the way that most people think sometimes. It just changes how platelets behave. And when that happens, it becomes harder for circulating tumor cells to hide, harder for them to travel, harder for them to spread. So again, this is another example of using a repurposed drug in that defensive nature. This is not a cytotoxic drug. It's not killing any cancer cells. It's not attacking tumors. But what it does do is it makes it harder for cancer to do what cancer does best, which is adapt, travel, hide, and spread. So we're using this as a very powerful tool to prevent that from happening. The dose does matter. This is a situation where more is not better. The antiplatelet effects of aspirin happen at very low doses, 81 milligrams. If you take higher doses, you're getting into the range where you're treating pain or inflammation, but you're not necessarily getting more antiplatelet benefit. In fact, you might be increasing side effects without increasing efficacy. This is another extremely inexpensive drug, so easy to add into your regimen, so easy to take every day. And it's just really encouraging to know that an integrative plan doesn't have to be complicated. It doesn't have to be super expensive. Sometimes simple works just as well. So again, this is about using the biological mechanisms of the drug. It's about understanding what the drug is actually doing in your body at the cellular level and why that might matter in the context of cancer. So what do you think about that? Two drugs, two completely different mechanisms, but what do they have in common? Well, both of them target the systems that cancer depends on. Loratidine modulates inflammation and immune signaling through histamine pathways. Dose Aspirin disrupts the platelet interactions that help cancer cells evade detection and spread. Both of them are working on the microenvironment, the terrain, the ecosystem that cancer needs in order to thrive. When we're talking about the integrative approach, we're talking about two different functions. One part of the plan is to attack and kill the cancer. The other part of the plan is to protect your body and build it up from its foundation. And I think that that is the paradigm shift that we really need to talk about more openly when it comes to integrative oncology. So much of conventional cancer treatment is about the tumor. Shrink it, cut it out, radiate it, kill the cells. Of course, that's important, but you have to also consider what you're leaving behind. Cancer thrives when the environment supports it, when inflammation is high, when immune surveillance is compromised, when blood flow is unrestricted and metastasis is easy. So these daily practices that we do, our supplements, our repurposed drugs, our exercising, all of this is to change that environment. Even these repurposed, familiar, unglamorous drugs, they don't promise miracles, but they are enough to shift the odds. They might tip the scales even slightly, but in a direction that truly matters. And I think that that's worth knowing. Don't you? Being informed doesn't mean going rogue. It doesn't mean self-prescribing or bypassing medical guidance. It means being an active participant. It means having agency. It means getting involved in your case. If you're curious about whether something like low-dose aspirin or loratadine might make sense in your own care plan, I encourage you to bring the research to your team and ask the questions. You deserve to be part of the conversation. You deserve to understand what's happening in your body and what the options are. And the more you know, the better those conversations can be. So take this information and use it wisely. Ask questions, stay curious, and above all, trust yourself. Be an active participant in your own care. Today, we talked about repurposed drugs that are already widely available, medications you might already have in your home. Next episode, I'm super excited. We're going to dig into prescription medications that are being looked at through the same lens. Drugs that were designed for different conditions and diseases, but what researchers are learning about their potential role in cancer care, and it might surprise you. And here's what I keep coming back to. Some of the most interesting tools in integrative oncology aren't new. They're familiar. We just haven't been taught to look at them from different and new perspectives. Until now. Thanks for being here, and I'll see you next time. Until then, keep thriving.
Just a quick reminder, everything shared on this podcast is for educational purposes only. Any new supplements, dietary changes, or healing practices should always be discussed with a trusted medical professional who understands your specific situation. My role here is to empower, not replace. If this episode was helpful, make sure to hit that follow button so you don't miss the next one. I'll see you in our next episode, and until then, you're doing better than you think. Keep thriving.